Good morning, everyone. I'm Dr. Karen Leong, and it is Monday morning, and I haven't had time to do my hair. Just sent the baby and the husband off to daycare and work respectively. Had kind of a bumpy weekend because hubby was sick and baby, I don't know, she's kind of on the cusp too after a week of daycare. But anyhow, thank you for joining me this morning. So I'm part of the face and body team with Dr. Edward Park, located in Upland, California. And we've been doing this Facebook Live every Monday for about a month now. We just finished our breast month in honor of breast cancer awareness. And now we are moving on to November. And it was just daylight savings this weekend. So I hope everyone picked up a little bit of extra rest. So for November and December, we're kind of focusing on a different area. It's the best time of the year to focus on your face and neck. You know, the sun isn't as hot as it is the rest of the year, although recent weather could tell you a little bit differently. It's a better time for recovery just because it's cooler. People are wearing more clothing, so you know it's a little bit easier to have your hair down and walk around as though you had nothing done. But what I wanted to start off with today is just talking about facial aging and kind of what happens as we go from our 20s to 30s to 40s and beyond. And then over the course of the next several weeks, we'll get to cover the topics of things that you can do to rejuvenate or to maintain your face so that the signs of aging are graceful and natural, but hopefully a little bit tempered. So I just wanted to say that Dr. Park and I fully endorse the natural look. We get this question a lot when women and men come to us to talk about what they can do to restore their neckline and their jowls and such, and their first concern is, oh, I still want to look like me. I don't want to look like someone else. I don't want to look pulled. I've seen people with really scary eyebrows. You know, I've seen celebrities and they just look awful. They don't look like themselves anymore. And I just want to say again, that's not what we believe in. I mean, I personally would never do anything to a patient of mine that I wouldn't do on myself or my mother or my sisters. You know, I'm starting to go through those changes myself, and I look in the mirror and I say, okay, is it getting time yet? And I'm still nervous, and I still understand why you are too. But okay, let's talk about what happens when we get a little bit older. So I always tell my patients that the things that you cannot change are time and gravity. Well, maybe gravity, but we're not quite there yet. But when we age, there are a number of things that we notice in the mirror and that we notice when we touch our skin, and you know, we just notice overall, especially from comments from other friends or when we try to put our makeup on. So just wanted to review some of those. I know there are a lot of those apps out there that can age your face for you if you haven't already gone through that process, and it's kind of disturbing and probably not that realistic necessarily, but there are a few things that are pretty consistent, and I just wanted to review those. So when patients come in for consultation, they kind of say a number of things, and the most common that we see are that you know, my eyes look tired, or I feel like, you know, when I try to put makeup on, I really have to pull back and I can't see my crease, or my eyeshadow and my mascara smear, or I have these bags under my eyes and I think they come from my parents, but they're getting worse, and I notice them in the mornings more than anything else. Or, you know, I feel like my cheeks are really hollow, or, you know, these lines here are just really deep and they didn't used to be like that, or, you know, what are these lines down here, and what's going on with my chin, and, you know, I feel like everything's just sagging here or down my neck. I've got all this skin, and I blame it on my dad. He's got the same neck. You know, these are very common things that we see. I just wanted to use myself as an example. These are my driver's license pictures, just taken 3 years apart. So you can see when I first moved to California, really awful pictures, sorry. This was in 2016, 3 years ago, and this was just this year when I went for my real ID. But I looked at my pictures and I said, goodness gracious, what happened in 3 years? I finished my training, I moved to California, I had a kid, and wow, what a difference. And I have to be totally honest, I don't do anything other than neurotoxin, like Botox or Dysport in my face, and I'm not wearing any makeup right now. So, when I look at my photos here from 2016 when I was bushy-tailed and chubby-cheeked, you can pretty much appreciate that my cheeks are still pretty full and up high. My skin looks, I've been blessed with good skin, I think. But I mean, for me, myself, I can tell with the elasticity. But just looking at my photos here, the things that I can really notice are really just where my cheeks have gone, and whether or not my nasolabial folds have gotten deeper. So I always tell people when they're first thinking about doing something to the face, whether it's a neurotoxin or a filler or something more invasive like a mini lift or a full lift, and then with the laser, is that from the age of 25 or on, we're losing about a teaspoon a day of volume in our faces. A teaspoon doesn't sound like a lot, but if you add it up over a number of years, it gets to be pretty significant. And then when you're talking about fillers, you're putting in one syringe, and one syringe is 1 cc or 1 milliliter, and that's equivalent of 1/5 of a teaspoon. So if every year from 25 up I'm losing 1 teaspoon, that's 5 syringes a year just to maintain what I've had since I was 25, and that's assuming that I start at the age of 25. I'm 38, that puts me 13 years behind, which is 13 teaspoons times 5, that's 65 syringes of filler just to get me back to what I looked like when I was 25. And that's just mind-blowing, So obviously we're not doing that. We're not throwing all that filler into your face, but there are other ways that we can rejuvenate and restore and reposition. I love using that word, reposition. So that's what's responsible mainly for this descent here. And I always tell people that when you're looking to correct these areas, it belongs up in the cheeks, because you're thinking of this kind of structural lift. Everyone looks in the mirror and they kind of go like this, right? And they pull up, 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 up. And that's because what we're trying to do is put our cheeks back up where they belong on our cheekbones. So when you smile, everything lifts, and that's where it's supposed to be. But as we age, this is kind of our malar fat here, our buccal fat, you call, and they used to belong there, and now it's sagging. And you can see for me, it's starting to settle down here, and then I'm getting this kind of like vertical hollowing along with some of that tear trough deformity. But when that happens, you can see with the cheeks settling down, now we notice that our nasolabial folds are a lot deeper than they used to be. You have to bear in mind that this is also combined with loss of the bones, especially in women. We tend to get osteoporosis and a lot of bone atrophy in the face, and a lot of that happens right here. So that's why, when the teeth start and the gums shrink, you notice that your lips start to look thinner and thinner. Then you always say, oh, my lips are disappearing. When I smile or when I put lipstick on, I feel like I have to color outside the lines in order to even see any lip. So again, that's the cheek descending, the bone recessing, and then the skin laxity, because we have less elastin and less collagen as we age, partially due to hormones and partially just because our cells are not regenerating quite as well as they used to. So now we're settling. Here you can see in me, tear troughs, nasolabial folds, sagging cheeks, and then if I keep going down, I'm going to get the marionette lines. They make you look like a puppet, like that. And then the jowls, as everything comes down, it starts to hang here where it's the most dependent. So then now you have jowls, and again here we're hollow, so that makes it more obvious too, and then the neck skin kind of drags. Okay, so someone's asking if I need fillers or a facelift. That's something that we determine at consultation. Again, we look at your overall facial structure, we look at the quality of your skin, we look at the areas where you are deficient and the areas where you have excess. And if we find that they are pretty minimal with good skin quality and you're willing to do that kind of yearly or every other year maintenance, then we could talk to you about doing a kind of combination of neurotoxins, fillers, and laser skin resurfacing or some kind of skincare maintenance. I always think of it kind of like a pyramid. You have to build from the bottom up. You've got to have great structure before you can overlay, and then the finish on the top is kind of like the texture and the color of the skin. So if your bones are already weakening and recessing and we have to restore that, then we think of filler or doing a muscle tightening with the lift. If we're thinking about elasticity in the middle, again, that can be something that's collagen stimulating like a laser or filler, or PRP, like a vampire facelift, vampire facial, where the growth factors kind of stimulate your own skin. And then the top of that pyramid there is, just the skin finishing on top. How do we maintain that healthy, thick dermis with that great glow? And that's talking about like vitamin A derivatives like retinol versus peels and lasers and hydrofacials, just to make sure that everything is buffed on top. For people who need facelifts, it's not limited to someone who's in their 60s and beyond. Those people, by the time you're thinking about that, you probably need a fairly significant muscle tightening and lift just to correct all these things that you see in the mirror. But there are people now who are coming in their late 30s and early 40s who are saying, what, I'm just starting to see this. I feel like my skin just doesn't rebound the same way it used to be. And I don't want to throw filler into my face. It doesn't belong in my face. What can I do that's just going to set me back about 5 years and last me 10 years? So for them, we're doing more and more of these kind of like little mini facelifts. And by mini facelift, I don't mean that we're just tightening the skin. We never do that. That doesn't do anything. Kind of liken it to making a bed, right? You have to really tuck in the sheets. You got to, make those military army corners before you can lay your duvet on top to have it nice and smooth. In the same way, we got to tighten the sheets underneath, make sure they're tucked in good, and then the skin will lay down nice and smooth. So, I'm focusing a lot on what happens in kind of like the mid and lower face, which is what a lot of people are mostly concerned about. We will also talk about eyes and then the brows too, because that kind of comes together as a unit. But basically with facial analysis, I always look at it from the top down. I don't just start on the area of concern, because it all comes as a unit. Imagine if we really corrected up here and then we neglected to do anything with the neck or the forehead. We would be doing you a disservice. And we try to be as ethical and conscionable as we can when we're working on people, because I know I am trusting you or me with your face. Your face. This is the thing that everyone looks at. This is the thing that you look at as soon as you look in the mirror. And, to be able to say, okay, please put me back. I place my faith in you. That is a big responsibility, and we take it very seriously. So, I just have to check the time. So as we're doing this series, I do really encourage questions, either for yourself or just in general, or anything that's related to the brow, the eyes, the face, the neck. We'll cover the nose, I think, in a different series, because that is not really facial aging. That's more of a structural type of issue. But I love skincare. I really like lasers. So these are things that I would enjoy talking about too. And we have fabulous estheticians and nurse injectors in our office. And, we just have a slew of offerings that we like to tailor and customize, especially for you. I know sometimes it's hard to come into a consultation and hear a whole laundry list of things, and you're thinking like, really, do I need all that? I've been fine all these years, and now they're trying to sell me all this stuff. And you can tell us that, I try to make a plan that's reasonable, as honestly, I'm very much a wash and go kind of girl. I don't even brush my hair. So for me, if you can do one thing and get a real bang result, do it, please. But if you're telling me that I need to chip away at it and wait and see, then I say, well, I don't know, I'll think about it. So you let us know what is right for you. Oh, yes, specials this month. Thank you for asking. So as of November 1st, we are starting our facelift special. That's $2,000 off our typical facelifting fee. I just wanted to mention that we do our face and neck lifts in our eyes under twilight sedation, which means that you're not under general anesthesia. You are very drowsy. You're kind of off in Tahiti or somewhere and just kind of dreaming. But if we ask you a question or we ask you to turn your head, you're absolutely able to. There is a little amnesia effect to it, so after we're done, you're not remembering what happened for the past couple of hours while we worked on you. But this is a very nice alternative to the standard general anesthesia. It's a little bit safer, and we like to offer it to our patients. So anyhow, I'm just going to end there today. I just wanted to do a quick kind of overall summary on things that happen as we age, kind of the loss of elasticity and collagen in our skin, the descent of the fat pads that used to be suspended nice and high, kind of like the loosening of all the ligaments that used to hold everything up that need to be repositioned and restored, and then just overall volume loss that we notice, around the cheeks, around here from bony loss in our lips, and the extra skin that everyone wished we could just, stand our heads and have them back where it belongs. So again, we're going to cover a bunch of topics from the top of our heads down kind of to the chest area, which include surgical and non-surgical and skincare. So if there are things that you're interested in, please let us know. Otherwise, I will see you next Monday. Stay tuned. Bye.